Good evening. Thanks for joining us. The Prime Minister is offering a message of support to some of Canada's most vulnerable people during the COVID-19 pandemic. That includes children and seniors, the homeless, and those who can't stay at home because they're facing abuse or gender-based violence. He says his government wants to ensure no one is left without the help they need. Before we get to how he plans to assist them, let's take a look at the state of the outbreak in this country. As it stands so far, there are more than 6,000 confirmed cases of COVID-19 across Canada. Quebec is still the hardest hit with more than 2,800 cases. Ontario has more than 1,300. BC, Alberta, Saskatchewan, Nova Scotia, and Newfoundland are among the provinces reporting more than 100 cases. Nunavut is the only province or territory without a confirmed case. As all Canadians grapple with this crisis, the government will spend additional money on assistance for children and seniors. But as Abigail Bimman reports, some frontline workers at risk say they still don't have the support they need.
In Montreal, day shelters are being set up, expecting to see 1,000 homeless people a day. But frontline workers don't have protective gear, even though they say they've asked for it every day for weeks.
We're putting our lives at risk to help those that are most vulnerable, and we do it gladly, but we would also like the support.
And the vulnerable are who the Prime Minister focused on Sunday. He reiterated his $200 million commitment for the homeless. That money is flexible and can be used for COVID-19 protective gear.
We're not going to forget you. We'll work with the organizations you rely on, and we'll have your back.
Justin Trudeau also announced new money, $9 million for United Way to support seniors and $7.5 million for the Kids Help Phone, once again addressing children directly.
There are people in your corner making sure you're okay.
There are other vulnerable groups who need help too. One example, airline workers. Staff of Ukraine's largest airline don protective suits, but you don't see that in Canada. An internal email obtained by Global News from one flight attendants union disappointed in public health's recommendations says government officials haven't got a hot clue about what employees face. Infuriating, to say the least. Meanwhile, in an effort to help healthcare workers bracing for a further surge, a new message from the country's top doctor about those wanting to isolate out of town.
Urban dwellers should avoid heading to rural properties, as these places have less capacity to manage COVID-19.
And the strongest language we've heard yet from a federal minister about what Canada faces.
That we are in a situation of war, or similar to a situation of war.
British Columbia and Ontario have already taken steps to centrally manage their supply chains, while Quebec's premier has been using military analogies for a few days. On Sunday, he urged everyone to follow the battle plan. Abigail Bimman, Global News, Ottawa.
And a reminder, children in need of support or counseling during these troubling times can call the Kids Help Phone 24 hours a day. That phone number is 1-800-668-6868. Researchers say there's an urgent need to find answers to a controversial question surrounding the pandemic. It all has to do with how children contract and spread the disease. There appears to be growing evidence of kids being infected despite a low number of reported cases. As Ross Lord tells us, the push is on to find out why.
As she researches the impact of the new coronavirus on different age groups, virologist Alison Kelvin suggests something has been overlooked: the role of children. She says 3 studies analyzing thousands of children show they do get infected, but their symptoms are often so mild they go unnoticed.
The bottom line of this study is that children can be infected. We might not know that they're infected, and this might play a major role in the virus transmission.
In a scientific journal, Kelvin and a colleague say there's urgent need for further investigation to inform policies in the coming days, weeks, and months.
Perhaps we need to get out into the public and do some contact tracing with our children, looking at both how much virus they're shedding, what type of disease they're having, are they asymptomatic or not.
She says results could change public policy on decisions like when to reopen schools. Then there are daycare centers.
We have to think about childcare, the daycare workers that would have to look after children, and then again, kind of be on the front lines of this virus. where children might be kind of a silent carrier of this virus.
In some provinces, including British Columbia, daycares remain open. In most others, they're closed. Some are reopening for children of essential workers. On its website, the Public Health Agency of Canada says it's unknown what role children play in community transmission of COVID-19. There are growing calls to dig deeper and find out. Ross Lord, Global News, Windsor, Nova Scotia.